is really important when caring for a patient with COVID, but it's extremely important in our environment because every patient that comes into the operating room is having an aerosolized generating procedure. An aerosolized generating procedure requires us to have enhanced PPE, and so ensuring that team members know how to properly don and doff that PPE is important. The first station is an information session where they're able to learn about COVID, how we're protecting ourselves here at Texas Children's Hospital, and then they move into a simulation where they learn how to don and doff PPE appropriately, and they actually go through a checkoff to ensure that team members feel comfortable in that process. And then they move into a full simulation where they are able to take a pretend patient from an ICU setting into the operating room, intubate the patient, extubate the patient, and then take them back to the ICU. One of the biggest risks that we have in the OR is during intubation. So ensuring that the staff members are wearing their N95 and goggles is very important for aerosolization. But then also our anesthesiologists have taken an extra step where they are covering the patient with a plastic sheet to ensure that if aerosolizations were to occur, that it would be trapped underneath that plastic as an added measure. We also have HEPA filters that are placed on our anesthesia circuits to filter out the particles and to ensure that we're not emitting those particles into the air.
And so for us, I think this is an overarching effort to ensure that our healthcare workers, our folks that are frontline, are protected as we're dealing with this. A lot of this could not be done without guidance from infection control, hospital leadership through incident command. So for us to kind of proceed along this pathway, we've had a lot of support institutionally.